All right. Well, good morning, everyone. It's another fantastic Monday morning here at Healthline Markets. It looks like I'm having some camera issues here this morning, so I'm going to do my best to make sure that I get you the information. But I might be off camera today. I don't know what's going on, but we live, we learn, we move on. That's how it goes. So, why we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission, and thank you for getting the information first. I really appreciate everyone being on these calls. We got about 31 folks on this morning, and it's getting hot and heavy for AEP. We are less than 60 days away from AEP. And then if you're looking at November, we've got ACA coming up into the mix very soon too. So we've got to get prepared. We've got to know what's going on. And the best way to do that is get into some training. So let's go ahead and jump into trainings. I'm going to share my calendar, share the screen here. And here we go. So let's see here. This week, we've got a lot going on. First and foremost, this morning, we've got United Healthcare doing an event training, how to conduct your events. This is important. This is a great opportunity to grow your lead sources. If you're not doing events or if you need an event upgrade or audit, if you will, this is a great training to get that done. That's today at 11. Humana's doing, at 1 o'clock, Humana's doing maximizing your grassroots efforts with referrals. There you go. Some great training there. That one's on demand, so you could just click the link there. It's 45 minutes. Cigna, who is going to be on the call this morning. We have a special guest from Cigna, and he's going to talk more about what's going on for Cigna here. But today at 3 o'clock, Ocala kickoff is happening over at the Brick City restaurant. It's a pretty cool place. So if you're in that area, go check out what Cigna has to offer for 2024. Also today, United Healthcare is doing their virtual office session, so that's still rolling throughout the year. So if you have any questions, concerns, you can jump on a call with them at 4 o'clock today. Moving over to the 22nd tomorrow, the value of UHC, that's at the United Healthcare office in Orlando. So if you're in the Orlando market, that is going to be pretty cool. You can check that out. NCD, this is a brand new carrier that we're going to talk about this morning for your vision and dental. So if you're struggling with your clients, whether they be Medicare or ACA, or if you're looking for a new way to attract clients, we have a training coming up tomorrow at 10 a.m. And this is a brand new product with really great commissions. We're going to talk about it in detail today. NCD is national, and they have partnered with Nationwide. So pretty cool product there. That is for tomorrow at 10 o'clock. 11 o'clock, United Healthcare is hosting member retention. Those of you that are the power of member retention, check that out at 11. Cigna's doing another kickoff session. If you're in the Palm Beach market, they're going to be at the Drive Shack at 2 o'clock tomorrow. Moving over to Wednesday, we have our very own Al Clancy available for virtual coffee and chat sessions, 9:30 tomorrow. Think of him as your strategist. If you want to run by your AEP campaign, jump on a call on Wednesday with Al, and he can tell you what you should be considering, what you need to be doing. Okay, he's your strategist. He's available to have a virtual coffee with you on 9:30 on Wednesday. Also on Wednesday, Devoted is doing their world tour with their rock and roll sessions. This is their first looks and rollouts that they're doing throughout the country. This one is in Miami in the Doral area, and they'll be at the Doral Country Club 10 o'clock on Wednesday. Cigna's doing their virtual office sessions on Wednesday at 11. And then we've got First Look for Freedom, Optimum, and Simply. That's in Daytona, 11:30 on Wednesday. Also on Wednesday, you've got another rock and roll session from Devoted at 2 o'clock. Cigna is doing theirs at Dave & Buster's in Orlando, 2 o'clock on Wednesday. And then we've also got some pretty cool things happening here on the Advent Health as well. So Advent Health has recently opened up their 65 plus well centers. And these are awesome opportunities to tap into new doctor's offices that are focused on seniors. So that's Advent Health. You can do a quick intro there at 3 o'clock on Wednesday. Melina is doing a brand new broker orientation on Wednesday as well, 3 o'clock. Moving over to Thursday, first looks for Simply in Jacksonville at 11. Cigna's doing a kickoff in Miami at 2 o'clock at the PBR Cowboy Bar. That sounds fun. Cigna kickoff in Cocoa Beach at 2:30. Another new broker for Molina training on Thursday at 3 o'clock. And then a couple more first looks. We've got Freedom in Orlando. Freedom Optimum Simply. This one's the big one. Orlando, 4 o'clock on Thursday. And then if you are in the Pensacola market, Devoted is doing their rock and roll session at 4 o'clock up there. Friday, 9 o'clock, starting a new session as we roll out HPM Shop 2024. This is a call in and ask Tom questions about Shop or get a hands-on training with Shop. That's going to be every Friday. It looks like he's doing that weekly on Fridays at 9 a.m. So check that out. Jump in there if you have any questions. There's going to be some changes we're going to cover on the Shop training as it starts to roll out. But that's the first session. Thank you, Tom, for setting that up. That's at 9 o'clock on Friday. United Healthcare is doing a MedSup rollout at 2 o'clock on Friday. That's virtual. And then virtual office sessions at 3 o'clock on Friday for United. That's the training for the week, guys. Remember to keep one foot in the classroom and the other one in the field at all times. Super important that you do that. How else will you know how to help your clients? All right. Been getting a lot of buzz about our tee-off session. September 22nd, please remember we've got our HPM annual kickoff. We're calling it our tee-off session, and all are invited. If you'd like to pre-register for that, pre-registration is still rolling here, and I put the link in the chat there for you. It is Friday, September 22nd, 3 o'clock, and very excited to invite you into the Orlando College Park area. We have 89 seats available left. I am going to be sending out emails and postcards to you about this event, but keep in mind that we only have space for 100 folks. So it is imperative that you RSVP as soon as you get that. All right. Let me jump over to SEPs. I'm going to go lightning fast here today. We got notice from Florida Blue that they have extended the SEP for Florida statewide for Hurricane Nicole, which happened almost a year ago now. And that SEP is going to be available until October 31st. October 31st, you'll be able to continue to enroll people in the SEP using an SEP for Florida Blue. So if you bump into somebody that does not have the ability to change, Florida Blue will accept an SEP for Hurricane Nicole as long as they haven't used that already this year. So quick summary on that. Some Medicare members may qualify for an SEP. The SEP listed below applies to all Medicare Advantage or Part D prescription drug plan members who were not able to make a plan change selection during AEP or another election period. And there it is. So real in red there, emergency management, Hurricane Nicole statewide, SEP ends 10/31. If you're in the Broward market, they're also extended to 10/31 as well. But again, that statewide pretty much covers you wherever you're at. So there it is. Keep in mind that Florida Blue is accepting that. Now, we are talking about NCD, which is a brand new product from Nationwide. And I'm hoping my presentation here works. There we go. So NCD sent us this quick screen here. And why should you consider NCD for your dental and vision or adding this to your portfolio? Number one, there's no training requirements annually. You just get contracted. And we do recommend that you meet with them so you get a good training session there, but there's no annual training. So it's very easy to onboard and get started. I've been very, very impressed with the speed on how these guys work. They have excellent commissions. Their support has been outstanding, and they have some pretty cool products. So with that, let's talk about commissions. They're starting at 21% commissions for all dental products and 34% on the vision. It remains level for the lifetime of the policy, so it doesn't degrade. And as long as the member's paying, they're paying you. White glove support. They're all US based. Their member care and agent support is not outsourced to another country. They have a one-call resolution. and they are available to complete contracting within 24 hours. So if you say yes today, they should be able to get you contracted within 24 hours. So pretty cool on that. Have some great reviews, over 1,200 4.9 star reviews on Google. They do what they say they do, and they're there to meet the members, agents, and everyone else that's willing to work with them. Looking at their innovative products, they've got annual maximums ranging from $750 to $10,000 on dental and vision plans. Pretty awesome. This is backed by MetLife and Nationwide. So these are well-known products. And then the VSP Vision Preferred, pretty awesome there. They're in all 50 states, and you do have some account management that's there to help you out in case you need it. So that's NCD. If you are interested in getting contracted or finding more information, you're going to shoot an email over to contracting@askhpm.com. Okay. Let me stop my screen here for a second. I'm going to put in the chat contracting@askhpm.com. There it is. And let's keep the party rolling. All right. Next up to bat, we've got a brand new marketing catalog that I want to make sure that you guys are aware of. So from the Gold Key, I'm going to show you how to get there. This is your Gold Key. Join hpm.com/Gold Key. This is your portal system for everything that you need. You're going to scroll down to marketing. The very first one says marketing catalog. You're going to click that, and off you go. We've got things like business cards, event flyers, Medicare 101 trainings. If you're an agency, we've got recruiting pieces. We've got postcards. We've got stuff for your doctor's offices. We've got Medicare basics. Lots of cool stuff happening here on the marketing catalog. All you've got to do, if you are interested in grabbing one of these pieces, there's a form at the top. You're going to click complete this form, and boom, just fill out that form and ask us what you're looking for, and we'll get you started. Okay. So there it is. Any questions on that, please shoot us an email at support@askhpm.com. It is our goal to have over 100 pieces available for you for AEP and beyond. So go in there, check it out. If you have suggestions, please let us know. We're happy to help. All right, with that, do I have Ron on the phone from Cigna?
You do, my friends.
There he is. Welcome, Ron
Morning,
from Cigna, Ron Landirez, our buddy, pal from Cigna. He is here to tell us all the good news about Cigna. And, you know, before you take the mic, Ron, I just want to say to everybody, Cigna Medicare is extremely valuable for us this year. We really need to grow this product. They have been extremely generous in supporting health plan markets. And I need you guys to pay attention to this because this is a product that is a focused carrier for health plan markets. So with that, take it away, Ron.
Awesome. Thank you again, Justin, and thank you for giving me the platform today to speak to your brokers. First and foremost, everybody, good morning. Happy Monday. I know that AEP is fast approaching. I know that we are all in strategy mode. And of course, you guys being at the excellent agency of HPM, starting from Justin all the way through their whole staff. I know that you guys have the best support tools and staff in the industry in Central Florida. So I'm confident that every single one of you is going to have a very successful AEP. With that being said, again, for those who don't know me, as Justin had introduced me, my name is Ronald Landirez. I am the direct agent territory strategist. I'm sorry, it's a new title, folks. I always mix it up. But essentially, I'm a broker manager. I focus on Lake and Osceola counties. But again, with the rest of our staff and broker managers, we all kind of work together. So if you have any other questions, you can always reach out to me, whether it is in those counties or not. But we also have Diana Castellanos, who does Orange, Polk, those surrounding areas. We also have Randy, who does more like Volusia. He does Brevard as well, too. And then we have broker managers in the Tampa and the Jacksonville area. A couple things I want you guys to all know. For those of you who have not been contracted, the first thing I want to start off is saying is that our contracting this year is a lot less cumbersome than it was last year. We heard you guys. We did a lot of broker roundups at the end of AEP last year. And one of the things that kept coming up was that our training wasn't exactly the funnest or the shortest of all of them. We definitely did not want to be in that category of having a very, I guess, long and just dreadful training. So what we did now is, for those of you who have not done the certification, we have an opt-out button, or I like to say pass-through, quickie, whatever you want to call it. You go in there, you take the exam before you even go through the modules, the portion that is allowed to do that. If you pass it, you don't have to go through the modules and keep going. So again, we understand that you all folks are doing AHIPs, a million other carrier trainings and so forth. So a lot of the information could be redundant, important as it may be, but redundant nevertheless. So we went ahead and did that feature. So I think it's kind of cool. You guys can get in there, take the test. If it's good, I mean, if you do well, you can just move on. The other thing I want you all to remember is that, again, for those of you who have not been familiar, who haven't written Cigna, well, first of all, for those of you who have written Cigna and partnered with us, thank you very much. For those of you who haven't, I'm just here to say, to remind you all that remember that Cigna is the biggest provider of commercial insurance in the state of Florida. Disney, Universal Studios, Boeing, Walgreens, the list goes on and on and on. So for those of you especially who focus on the turning 65 market, those members are looking for branding, make no mistake. I always like to mention the fact that while everybody knows that Samsung's camera is optimal and is probably even better than the infamous iPhones, iPhone still has a huge market share, not only because their products are great, but because they have a big standing in in the branding category. So when it comes to Cigna, not only are we a great company, but we have an existence. We are a global company. We are familiarized in households because of what their branding has been for so many years. So keep that in mind as well too. We also know that you guys are all setting up for your AEP plans, and it includes all the other carriers. But we just want to make sure, my job today, along with our kickoffs, which I'll be mentioning in a second, is to make sure that when you guys are sitting with your members, that you do have Cigna in your bag. Because at the end of the day, there is a demographic that wants that. There is a demographic that understands that branding is important. And especially for those who are coming off of a Met-Sup or something like that, where they're not necessarily ready to pull the trigger on a Medicare Advantage plan because they're just not familiar with it. That hasn't been the way of delivering their health care. Having a plan like Cigna, which they're familiar with on the branding side, is definitely something that you guys can have a win on. With that being said, we as Cigna, as Justin was mentioned, we are very, very much in growth mode, aggressive growth mode. So no idea is too big or too small. Please reach out to myself or my other broker managers, and we can get some stuff going. I know that this weekend I met with Justin and the agency partners. There was a lot of great ideas of turning 65, mailers or social media campaigns or so forth. Again, folks, we have to leverage the branding. So for instance, if you are doing something like a T65 campaign, one of the things that you want people to do is get excited about. You want them to come. And how are they going to do that? They're going to come when they see a name that they trust, that they, not to say that the other carriers are not trusted or good, but if you put them side by side as far as just straight branding, and you're trying to attract a crowd who's new to Medicare, it doesn't hurt to have a name that's pretty household. The other thing I wanted to mention too is that I'm not going to let too much out of the bag. The 29th of this month, which is next Tuesday, we will be doing our kickoff, and that's going to be at Andretti's. I'll be sending the email out to Nick and to Justin and to the HPM staff to cascade along with all the other kickoffs. We actually have one today in Ocala at 2:30 for those of you who are in that area. Please put in the chat or let somebody at HPM know if you guys don't have that information. We're going to be also in Raymond James Stadium for Wednesday of next week for the kickoff in Tampa. And then, like I said, I'll be cascading the whole schedule. But just a couple of highlights. Keep in mind that we are going to continue to have a PPO product, but this year we're going to have an additional PPO product that's going to be same benefits in and out of network. So that's the only snippet I'm going to give you guys. We have some other great stuff coming down the way. But again, Let's make sure that not only are we waiting for AEP to enroll members and to give them the opportunity to see all the benefits that they can enjoy with Cigna's product, but also keep in mind that we still have a lot of time in 2023. So if there's any ideas that you guys have, anything that you guys want to get on the books right now with me, please make sure that you are available to have some time with me. I'll make sure that, again, I'm going to also send out a broker contact sheet to Justin and the team so you guys can cascade it out as well too. That's going to be all our contacts from all our different locations, including what counties we service and exactly who you would need to contact if you have an initiative in that respective county. Hablo español, so for those agents who need a little bit of training or something in the product in Spanish, I myself, along with Diana Castellanos, will be more than happy to come and meet with you guys either at HPM or somewhere offsite. We'll do some in-depth training on what Cigna is, because the reality is I know that a lot of you on the phone too have either not sold it because of familiarity or because of the perception of you guys may have because you guys haven't sold it already. I can assure you our network is getting stronger. As an enterprise, we are striving to get our commercial network and our Medicare network as close as they possibly can. We have had a lot of strides. Also, our technology is getting better too. For those of you who have seen our Producer University, it's got a new look. Also, our provider lookup tool has also mirrored now what commercial used to use or does use. The technology is merging now too. So a lot of great things coming down the pipe for Cigna. Again, for those of you who have not certified yet, make sure to do that. Make sure that that's on something that you want to do, because again, not only is it training pretty easy this year and a lot less, long, I should say, but more than anything, again, we just came back from our national sales conference, and our theme was this year, the advantage is us. So as much as every single one of you, and you guys are probably going to hear me say this throughout the rest of the AP, maybe even at the kickoffs, but the advantage that all your prospective members have is not the carriers that you provide, but it's you, the knowledge that you bring, the resource that you bring as a broker to them. So we want to make sure that that's the same attitude that you guys take towards us, and that you guys, in what light you see us. We're here to help you guys. We're here to grow your book of business. Yes, we are specifically a Cigna team, but at the end of the day, if you find yourself with some questions on Medicare in general, on Medicaid or so forth, all of us have had extensive years in the managed care industry. We'll be more than happy to help you. And if we get a couple of sales of Cigna in there, that's going to be great too. So again, not too much information I wanted to divulge, because I just wanted to remind you guys that 29th is our kickoff at Andretti's in Orlando on iDrive. I will be sending out the information, but can't tell you guys enough how excited I am to see each and every one of you out there. Again, it's one of those things where we get a chance to really fellowship and talk to you guys about what we can do to help you grow your book of business with Cigna, and all the great exciting things that are coming out. So if any of you guys want to take a crack at it, I have a few more minutes. If you guys want to send me some questions their way, or if you guys want to open up for questions, or if not, you guys can go ahead and send me some questions. What I'll do is I'll put my email address on the chat right now.
Cool. Why are you doing that? Any questions? Because I have some.
Okay, go ahead. Shoot.
All right. Well, first I want to say how awesome it is for a carrier to give you a test out feature for your certification. I don't think you guys understand what that is. It's amazing. So if you've already sold Cigna last year, you get an option to just test out. You don't have to go through 1,900 modules and clickety through the slides. You just take the test, which is amazing. That saves you at least an hour to 2 hours of certification time. So it's amazing. If you haven't sold Cigna, or you haven't sold a lot of it, it's probably a good idea to go through the benefits anyway and go through the slide deck. But if you are currently selling Cigna, that test out feature is amazing. So I do want to kind of load this question here, Ron, to kind of frame this out. You were an agent at one point. You've been captive. You've been a broker. You made a comment to me this weekend, like, man, with all the great stuff that's out there, not only at HPM, but what's going on in the market, I would consider going back to being an agent. But my question to you is, we're August 21. We know October's coming up quick. Outside of Cigna, if you were an agent, what would you be doing right now? What would Ron be doing to grow your book of business?
Oh, well, right now it's all about prep. So for us on the side of the managers, Justin and his team and stuff, this is our AEP. But as brokers, you guys kind of have a dual role. You guys have to have preparation and then execution, right? So right now, the biggest thing that I would be doing besides attending all these rollouts and the MSO parties that are coming up now, which is all great. But right now, I think the biggest thing right now, you guys need to just be prepping, making sure that you're reaching out to your book of business, not only to make sure that they're going to stay with you guys, because of course that's part of the business, but also to because that there's so many changes coming up, make sure that your book of business is aware that not only is every year there's differences, but these last couple of years have kind of been that way where some companies want to make a big splash or so forth. So you want to make sure that you're reaching out to your book of business. And not only that, though, the most important thing, all your book of business members are within that age range. So guess what they have a lot of? They have a lot of friends who are probably turning 65 or or with another agent or are not happy with the carrier they're currently on now. Like I said earlier today, remember the advantage is us. We are the advantage. We are the resources. We are the SMEs, subject matter experts. Make sure that your book of business is aware of that. So when they're out in Sedanos or they're speaking at a Domino's tournament and someone's telling you about this awesome, great other plan, hey, you're a broker. The point is, make sure that you're the one to tell them about that great plan. And I will tell you one thing: when I was an agent, my manager I used to get upset if I lost a member or something, and I go, listen, let me tell you something, and I live by this, and this goes the same thing for whatever position I've had, broker, captive, now as a manager, whatever the case is. If your client doesn't know you automatically when someone mentions Medicare Advantage plan, you're not reaching out to them enough. So if I have a
Mhm.
member out in the community and someone comes up to them and says, "Oh my God, this new plan is great," and whatever, first thing out of their mouth should say, "You know what? I'm gonna check that out. I'm gonna call my agent." And how do we do that? With touches. Make no mistake, crew. This is a touch industry. Relationships are big, but more than anything, the amount of touches and the consistency you have. Now, again, you want to keep your book of business growing, but also sustain your book of business. That is a key thing. So right now, for me as a broker, the main thing I'm doing right now is setting up my events to be in the community, making my plan already. So when October 1 hits, I can already be hitting the ground running. But most importantly, making sure that your people know that, hey, this important season is coming up. Any questions you have, I'm your guy or your gal.
And thank you for that reminder. Guys, remember August 23rd, in 2 days, August 23rd is the absolute deadline to get your book of business loaded into Spark. So we're using the platform to run postcards to your book of business. And what Ron was saying is if you're not calling, texting, emailing, mailing your members, they can get out of your coop. Okay, these are your chickens. You got to keep them in the coop. The way to do that is to continually communicate with them. So August 23rd is the deadline. You've got to get that signed up by the 23rd, so that you have 2 days to get that set up. This is the final warning. Anyone else that does not have the Spark platform loaded with your book of business by the 23rd, you are not going to get postcards mailed to your members. You will not get your postcards mailed to your members. This is a free service. It costs money to do this. We are covering it for you. We will not be doing it outside of Spark this year. Absolutely 100% no. We have given a multitude of warnings on that. So, like Ron was saying, get prepared. Retention is huge. Um, Ron, you had mentioned that you're willing to help with marketing. Can you expand on that with some of the things that maybe our folks are doing on the events, or maybe they want to do a T65 mailer or anything like that? What's something specific that they might be able to tap you for?
Absolutely, absolutely. So I know that we're getting to AEP and stuff. So I would say as far as the AEP, any events that you guys have, like for instance, I know that Vermilda and her husband are doing something in Lake County that they do every year, which is a great event. Cigna was the first person to want to jump on that because we want to partner up, especially with events that we see a lot of traffic and a lot of things that are going to be coming out in the community. Make no mistake, you guys all know that the prospective members now, our T65s or even our 65 and older members, are way more knowledgeable now. So we have to be out in the community. We have to be engaging them because they're inquisitive and they have questions. So you want to be out there. So any events that you guys have coming up, whether it's as little as a bingo or if it's a huge festival, anything that's leading up to AEP, you're partnering up with your MSO partners as well too. Bring us in. Let us have an opportunity to help you guys out with your tablecloths, with your swag, and so forth. And I want to make this very clear that we're on the phone, and I'm glad Justin brought this up too. Is that we understand that you're brokers. We understand that every single sale is not going to go to Cigna if we sponsor something. And here's the other thing too. That should be the right way, regardless of what position you're in. At the end of the day, do the right thing at the right time, and that's putting the member in the appropriate plan. But with that being said, we still want to make sure that when you guys go out there, we have Cigna top of mind, and just to give us at least the first opportunity to do so. So please don't think that if you're going to do an event with us, we automatically have to throw in 1,000 sales. We just want to be top of mind. And of course, if it's a big event and you guys get some lead, we're hoping that that you guys consider us and give the member the opportunity to be introduced to Cigna. As far as rest of the year, OEP afterwards and so forth, I can't stress enough how aggressive Cigna is being with their T65 campaigns. I can't stress enough how important it is because I've seen it with my own eyes, how much of traffic we get just simply with the name. If, for instance, I'm doing a T65 Medicare 101 powered by Cigna, it's powerful because of the fact is these members are looking for information, but they're brand new to Medicare Advantage, to A, B, and C, and all this stuff. So it's a lot comforting, and it'll have a better draw if they say, oh, wow, Cigna, I've heard of them. I actually still have them. I'm going to be coming off of them. I understand how they work. So it'll be that much easier for you to get that traffic because, folks, at the end of the day, this business is a lucrative business. It's a fun business. It's a business we get to help people. But and every single one of you on the call is probably a killer and a closer. But at the end of the day, the most important and the hardest thing to do is to be able to get in front of qualified members. We all know that's the biggest hurdle. So getting a T65 campaign and having people actually come to your T65 campaign is huge, and Cigna's branding is definitely going to help in doing that. So we're totally open to do events for AEP, post AEP, and again, it's just a matter of a conversation. Let's sit down. We'll talk about ROI, and return on investment, and we'll see if it works out, and we can talk about all those things in details. Again, I put my information in the box there, my name, my phone number, and my email. You guys can reach out to me. If you have any ideas, we'll sit down. And again, don't worry about the scale of the project. Let's just talk about it, and then there's always a solution how we can make it happen.
Outstanding. Awesome. Question from Will. Who should be contacted regarding uploading book of business? Okay, you're going to send, Will, as always, support at askhpm.com. There it is, or 844-696-3975. Just shoot us an email or give us a call, and we're glad to help you with that. And again, Ron's available. He put his stuff in the chat, but if you want to connect with Ron via us, it's the same contact information. Guys, the clock is ticking. If you want to grow your book of business this year, folks like Ron are there to help you. So make friends with people that know how to do this business. That's how it works. So, Ron, thank you very much for your time this morning. I appreciate you going over above and beyond as normal. So we really appreciate your time.
No problem. I look forward to seeing all of you on the 29th and also getting some phone calls or emails on some great ideas for AEP and beyond. Thank you guys again.
Cool. All right, everyone. That's the top of the call. I appreciate everyone's time and attention this morning. We will see you here, same time, same place, same channel. And as always, these calls are being recorded for YouTube. So if you miss a call, don't fret. You can go out there and get the same information at Health Plan Markets. All right, guys, have a fantastic and successful